Health IT is rife with acronyms that can be bewildering to those who are unfamiliar with the terminology. We will begin with acronyms related to EHR technology, meaningful use, and HIT. A CCD is a continuity of care document. A CCD is a data standard used in EHR systems to export and exchange information. The CCD is based on XML, so it can be read across platforms. It is intended to specify the encoding, structure, and semantics of a patient summary clinical document for health information exchange. CCD has largely been supplanted by CDA and CCDA. A CCDA is a Consolidated Clinical Document Architecture. A CCDA is a data standard used in EHR systems to export and exchange information. It is an XML-based set of templates for standardizing CDAs. The capability to export CCDA documents is a requirement for 2014 EHR certification. A CDA is a Clinical Document Architecture. The CDA is a data standard used in EHR systems to export and exchange information. CDA defines the structure of electronic clinical documents needed for the appropriate information to be captured, stored, accessed, displayed, and transmitted electronically for use and reuse of the information in many formats. CDA documents are structured in XML and consist primarily of a header, body, section, and narrative blocks. The XML format enables both human and machine readability. CPOE is Computerized Physician Order Entry. CPOE is a process for electronic entry of medical practitioner instructions regarding the treatment of patients. CPRS is a Computerized Patient Record System. A CPRS is a client-server interface that allows healthcare providers to review and update a patient's electronic health record. A CQM is a Clinical Quality Measure. A CQM is a standardized measure of clinical quality performance that is recorded within the EHR. Recording and reporting CQMs is an important part of the Meaningful Use EHR incentive program. An EH is an eligible hospital. An EH is a hospital that is eligible to participate in the Meaningful Use EHR incentive program. An EHR is an electronic health record. An EHR is a collection of electronic health information about individual patients or populations of patients. The term is often used interchangeably with electronic medical record, but in the strictest sense, an EHR incorporates a more diverse array of data than an EMR does. Most professionals now prefer the term EHR over EMR. An EMR is an electronic medical record. An EMR is a collection of electronic health information about individual patients or populations of patients. It essentially represents a digital form of the health records contained in traditional paper charts. The term is often used interchangeably with EHR, but in the strictest sense, an EHR incorporates a more diverse array of data than an EMR. Again, most professionals now prefer the term EHR over EMR. An EP is an eligible professional. An EP is a healthcare provider who is eligible to participate in the Meaningful Use EHR incentive program. An EP must have a National Provider Identifier number and cannot spend 90% or more of their practice in a hospital. ERX is electronic prescribing. ERX is the computer-based electronic generation, transmission, and filing of a medical prescription, taking the place of paper and faxed prescriptions. FAST is Federal Adoption of Standards for Health IT. FAST is a set of standards intended to improve the quality of patient care while reducing costs by simplifying and expediting the sharing of healthcare information while also protecting privacy and security. FEA is Federal Enterprise Architecture. FEA is the enterprise architecture of the federal government. It provides a common methodology for IT acquisition, use, and disposal in the federal government. FHA is Federal Health Architecture. FHA is a federal healthcare IT environment that is interoperable with the private sector and coordinates healthcare IT activities among federal agencies. FTF is the Federal Transition Framework. FTF is a single information source for cross-agency IT initiatives using a simple, familiar, and organized structure. It contains government-wide IT policy objectives and cross-agency initiatives. HIE is Health Information Exchange. An HIE is an organization that enables the sharing of healthcare information electronically across organizations within a region, community, or hospital system. Alternately, the term can be used to refer to the exchange of such information. HITECH is the Health Information Technology for Economic and Clinical Health Act. The HITECH Act provided funding to encourage the rapid adoption of HIT. It established the Meaningful Use EHR Incentive Program, funded regional extension centers, and increased funding for the Office of the National Coordinator. The HITECH Act also made many changes to HIPAA, including increased civil penalties and requiring business associates to comply with HIPAA to the same extent as covered entities. The HITECH Act was enacted as part of the American Recovery and Reinvestment Act, or the ARRA, commonly known as the stimulant. HL7 is Health Level 7. HL7 is a set of data standards for the exchange of clinical information between electronic systems. HL7 also refers to the nonprofit organization that oversees the development of these interoperability standards. MU is Meaningful Use. MU is a government program designed to encourage providers to adopt electronic health records and optimize their use. The Meaningful Use EHR Incentive Program proceeds through 3 stages over 6 or more years, with different requirements for individual providers and hospitals. The Medicare program is administered by the United States Department of Health and Human Services. The Medicaid program is administered by individual states. The Nationwide Health Information Network, commonly called NHIN, is a set of standards designed to enable secure health information exchange. A Picture Archiving and Communication System, or PACS, is a medical imaging technology that provides economical storage of images. A Personal Health Record, commonly called PHR, is a health record in which health data and information related to the care of a patient is maintained by the patient. PQRS is a government reporting program that uses a combination of incentive payments and penalties to promote reporting of quality information by physicians and other eligible professionals. PQRS was formerly known as PQRI. REC, or REC, is a regional extension center. A REC helps healthcare providers adopt and achieve meaningful use of electronic health records. RECs receive significant federal funding through the HITECH Act, but now operate independently. ROS is Review of Symptoms. ROS is a technique used by healthcare providers for eliciting a history from a patient. The ROS is often structured as a component of an admission note covering the organ systems, with a focus upon the subjective symptoms perceived by the patient, as opposed to the objective signs perceived by the clinician. The SDLC is the System Development Lifecycle. The SDLC is a process for implementing or altering information systems, including EHR systems. It defines distinct stages to facilitate project management and timely implementation. SNOMED is the Systemized Nomenclature of Medicine. SNOMED is a comprehensive, computer-readable collection of clinical terms that facilitates the use of structured data in EHRs and other digital technology. EHRs must use SNOMED to encode clinical information to earn 2014 certification. SOA is Service-Oriented Architecture. SOA is a set of principles and methods for designing and developing software in the form of interoperable services. VistA is the Veterans Health Information Systems and Technology Architecture. VistA is an open-source EHR system used throughout the U.S. Department of Veterans Affairs. XML is Extensible Markup Language. XML is a markup language that can be read both by humans and by computers. XML is useful for encoding content that must be used across different platforms. It is important for EHR interoperability.